So let's talk a little bit about some of the stories and, what you've experienced after all these years of serving folk and providing for them an, an access point, a safe quality access point where they are not going to be judged, where they're not going to be put through all that shaming and blaming that shows up. Yeah, I mean, so let's think in the pregnancy care, for example. I mean, we do a lot of that. What have you experienced over the years? Tell us a little bit about how some of the moms that may show up, some of the patients that come in, what are they dealing with? What are they having to handle?
Good question. So I had a patient that transferred care. They just didn't feel connected to the provider. And so they transferred to our practice. And when they transferred, they sent their records over. They were all blank pages.
Oh my goodness. So you mean there wasn't any information on the pages from the
No
So this is from the
information
physician's office?
from a physician's office. And this patient was
Wow.
very upset because that held up the process of her appointment. Although we figured it out, we had her visit, we told her we will call them and get the results, but she was upset that they didn't send her information. She already felt that there was a disconnect with the provider, but when she came to us, as soon as she walked through the door, she was happy with how she was greeted. She was excited that she got to meet the provider and connected with the provider. And also, just how we explained how we do things at our practice. So she felt at ease. And that really is a good thing because of what she went through before. So by the time we got her records, there was something minor, like a low iron or something like that, that she wasn't aware of. They
Yeah.
didn't tell her.
Yeah.
So I let her know, like, hey, we received your records finally, and this was going on. Were you aware of this? And she said no. So I told her we're going to do these natural methods to try to help you with your iron. And she just liked that. So the next visit, when she came back, we greeted her like, hey, like we remember her. And she was so excited. Her and her husband both showed us pictures of their 3D ultrasound, their 4D ultrasound of their baby. And they were just so excited that they had a connection with us. And they were so excited that, oh, let me share with you this
Yeah.
and that. So I just feel like it's when you first meet a patient, you want to be connected with them. And she didn't have that connection with her last visit, her last provider.
I mean, there's so much inside of what you're sharing there, Katrina. I think from the perspective of, busy physician practices, busy clinics, busy centers, I'm not sure that, and I don't want to suggest that all physicians' offices or centers or clinics are so busy that they can't provide that connection points, that they can't be personable. But what we know, what people share with us all the time, is that they do feel like they're just a number. They don't feel seen. Often, especially people of color, black people, indigenous people, folk who are marginalized as well, they don't even feel heard. Like no one is listening to me. No one is paying attention to what I'm saying, or even no one's asking. Like it's
Yes.
almost like we just don't need to bother. You're just here, and almost you're annoying for being here. You're in the way. You're extra work. And so when you mentioned the part about this particular case where even the records were incomplete, if you were if the patient was moving from one client to practice to another and those records were in that state, you can imagine that another provider might have very little time or energy or interest even in trying to get to where the real records. That would just be another barrier for there to be some consternation, some frustration, some eye rolling,
Yes.
huffing and puffing. What do you mean you're sending us records that aren't complete? We still don't have what we need. And it may even impede you getting an appointment at all.
Right.
Right? Some little thing like that could be so detrimental with a client who's trying to change from one provider to another.
And I think that's what upset her because I told her, well, we need to see what you have because you're so far along,
Right.
28, 30 weeks.
Right.
We need to see if you had your prenatal panels. She said she did, but they didn't have the records. But we helped each other
Yes.
because I asked what lab she used, and then we just went on the lab site And we were able to retrieve those records to see that she did have her blood work done, initial new OB labs, and she had her glucose test done.
Yeah, it's interesting to me to hear what you just said, because what you mentioned is that you went beyond and around to help solve a problem that was quite a big problem, technically, because you're accepting a patient, already accepted her because she's actually in the middle of the visit. She's in the building.
Yes.
She's in the exam room.
Yes.
She's already being seen. And yet, you don't have what you need. And she doesn't know that you don't have what you need. And
Correct.
she can't impact the fact that you don't have what you need. But yet you went over and above, went around, and went directly to the lab itself to see if you could get those reports. And sure enough, you did.
Correct.
So you answered and solved your own problem that you needed as a clinician. She, in turn, got served in a way that was really above and beyond the call of duty.
Yes.
But this is what I really want to stress and to put out there, and I'm sure as people are listening, they may be able to relate to these similar, I'm just going to call them microaggressions. I'm just going to put it out there in that way, because whether or not, we expect that folk are doing these things out of maliciousness, I don't think it's always that. I think it's just systemic. I think the systems are set up to be so unwieldy, so difficult, so bureaucratic, so heavy on all these extra unnecessary hoops sometimes necessary hoops, but nonetheless, they're burdensome.
Yes.
So that the providers are in a bit of a pickle,
Yes.
as well as the patients and clients are in a bit of a pickle.
And it stresses them.
It stresses everybody, right? It leaves everybody in a bit of a dilemma. If she hadn't have come to your office at that time and had you intervene, she might have found herself without a provider, period, for the rest of the pregnancy.
Without an appointment, just delaying her
From
and
getting
like
started,
I said,
yes.
The best part about us and why I feel that my group is the best is because we go over and beyond.
Yes.
We try to figure it out to make the patients at ease. Although we had to go through some hoops to get the records, it's okay. We want to make sure that she has what she needs and she's able to continue her prenatal care.
Exactly.
Just because she's worried, she's nervous. She didn't get that connection
Yes.
with the previous provider. So she's like, okay, I'm going to a new place. That's
Right.
like if you're going into a meeting with a group of people you don't know, you walk in the building, nervous.
Of course.
So that's how she was. And just to say, don't worry, rest assured, we're going to figure this out. Where did they send your labs? Oh, I believe it was Quest. Perfect, no problem. And we got online, we got the records, we have this. Where did you have your ultrasound? Oh, I believe it's Simon Med. Oh, perfect. We can call Simon Med and get your ultrasound. Although we still need those records, they came blank. But we have something in our face right now to review while she's in the building.
That's right.
Because she's so late entry.
Yes.
So, and she said, yes, I did have all of these tests done. So it really works out. But I just feel that we're the best because we go over and beyond. Most offices are going to say, we don't have it. Can
That's
you have
right.
them send it again?
Or even you just can't have an appointment, get off the phone, sorry for you.
Yep.
I mean, I think this is really important on two counts. One is that, again, from the patient perspective, it's a big deal to even have enough courage, because it needs courage in the United States to leave one provider to go to another. Ridiculous, but that's the truth.
Yes.
It needs courage. And then from the provider's perspective, the lack of interest or willingness to accommodate these different situations that show up through nobody's fault.
Right.
Right? I mean, we don't know why someone would fax a bunch of blank records, but that's literally what happened. So
Right.
here we are.